I'm joined here today by Nick Elliott of the Learning Clinic here at EHI Live. So Nick, thank you very much for your time today and welcome. So just to kick off then, given your vast experience within the NHS, what improvements do the NHS need to make to healthcare planning?
Well, I think the big bit in healthcare planning is actually about the data and having enough to properly understand the services that people are trying to deliver and how well you do that. And some of the big data stuff you hear about out now is actually key to that. We have a lot of data in the health service, but we're not good at tying it up. And I think the key thing is to find a way to take that data and actually make it more understood so you can actually visualize the service, identify the areas that need improvement, and identify the areas you actually want to have more of. And I think that from a healthcare planning point of view, if you can capture that data, join it together, you can do something really exciting that will transform the way we plan healthcare as we do now.
So that's the vision for the kind of whole NHS at the moment, but for you personally, can you tell us what your vision is for patient-centric care within the NHS?
Well, it's quite simple. Patient-centric care for me is very much about bringing all the information to the side of the patient. So it's actually mobility, it's having mobile devices by the side of a patient that provide the clinician with the information they need and allow them to collect that information at point of care, because that's when it's at its most accurate and it's most relevant. And you're sharing it instantly with people, but it really will transform the way the clinician is able to interact with the data, and if they're using it and believing in it that much, actually you'll have a really valuable resource that then healthcare planning and other things can all utilise to make the service run better.
In terms of patient safety, how well is the NHS equipped to deliver the safest possible care?
Well, I think as a rule you would say they're not that well equipped. The capability's there, but it's not being leveraged yet. And I think that's the part, if you look in any system when you get into safety, I used to do engineering a long time ago. When you get into safety and aspect, what you do is you get data on what's happening and you identify things like trigger points and areas where things are getting worse or better, and you're able to create reaction from that. And I think the intelligence is starting to exist in the market. There are a number of good products around that help do that, but it's leveraging that so that you can actually see what is the optimum way to treat certain groups of patients and identify deviation for the point of view of checking that the deviation is appropriate and it's not through diversion of resources, for want of a better phrase. And so I think that can really improve our patient safety tremendously. And there's good evidence from our own company. There's a lot of good evidence around.
Nick, can you tell us a little bit about the Learning Clinic's latest development and how you're aiming to help deliver safer care?
Well, the Learning Clinic kind of started from that safer care. We went through really focusing on a deteriorating patient, which was a great start point. So we now have this really rich, detailed clinical data set that's relevant to frontline clinicians. And so our latest development is we've taken that into the area of flow in hospitals, where we realise we know where every patient is, we know what it is that the patient needs to get the best care, but what we also now do is we capture what the patients are waiting for so they can be discharged to wherever that might be, the best place for them. And so now you're able to get a complete real-time overview of a hospital on a mobile platform that tells you what every patient's waiting for, whether that's a clinical need or a discharge, and then how you might deliver that. So you can start to make real-time decisions about resource placement that will truly impact on patients and their outcomes. And I don't think that's ever been achieved before in that sense. And it's the combination of the mobility and the quality of the data, because we collect it by the bedside.
So why are and should NHS organisations partner or work with the Learning Clinic?
Well, they've seen a couple of unique points from us. The first thing is the work we've done to improve patient outcomes. We've taken the effort to go and evidence this, which very few people do. So you can go to quality journals like the BMJ and you'll see 2 articles from us in there, one about the near elimination of infection outbreaks, which is a big impact for the NHS, and one actually about mortality with 18% improvements in mortality. And that's driven by using the data to help clinicians and steer the way care is delivered to patients. It's that patient safety question. And then a lot of organisations at the moment get very excited when they see what we are doing on the flow agenda. We are hitting the points that come from experience of working in the hospitals about what really will enable you to change the way your system is organised and to respond to changing needs, and not doing it on a system that's been around for 20 years that most people know doesn't work. And it doesn't matter what you do with it, it's not designed to work. So we've tried to work with trusts who are interested in redesign, and we've come up with processes that are very strong and resilient to the way the health service works.
And just another final question actually, can you tell us why clinical engagement is so imperative to IT projects across the NHS?
it is the key to unlocking it. Our approach at the Learning Clinic was we've developed apps that the clinicians love. They recognise them as clinical apps. We don't ask any administrative functions, but they love the way they work and they want to own them and they want to keep them in their hand. And because of that, they use our tools to a huge extent. We're collecting over 5 million sets of observations a month on patients because our apps are so loved. And it's the secret to that has really got clinicians embraced in our work and on board. But when we design, we work with clinicians. They know what it is that they do. What we've got to do is find a way to make that more consistent and of the quality that they want to achieve. And that's been key to us, and I think for everybody. If you can't achieve that clinical engagement at that level, then you need to rethink how you're approaching your part of the market, I'd say.
Nick, thank you so much for your time today. It's been a pleasure speaking with you and learning about what the Learning Clinic is all about.
Thanks.